I am an adult rheumatologist. I practice at a large academic institution, University of Pennsylvania in Philadelphia. I specialize in autoimmune diseases and as part of the different autoimmune conditions, we come across with wAIHA often. So wAIHA is an immune-mediated condition in which patients, due to an underlying autoimmune process, people develop the hemolytic anemia that has to do with warm auto-antibodies, meaning that in particular temperature circumstances, these antibodies or proteins bind to the red cells, and they cause hemolysis. Hemolysis is a particular process in which the red cells kind of burst, and patients' hemoglobin and red cell count drop dramatically, and the consequences of that are observed on the patient level. Most importantly, they need to be diagnosed. And then, we have to be sensitive to this particular condition. And as a rheumatologist who deal with different hemolytic processes or different anemias, so to say, associated with autoimmune conditions, this is something that we always have to think about when somebody has a sudden onset of a hemolytic process with, in my case, with an, associated with an underlying condition. Or I have to say that sometimes we come across with, in the hospital setting, we come across with acute situations where the rheumatologist is being called in a particular clinical scenario when the patient has hemolysis, and we're trying to figure out whether it has to do with an underlying autoimmune condition or it has to do with an underlying hematological condition, as these can be seen in not only in autoimmune diseases, but also in just hematological diseases. So the management, once you establish the diagnosis, is generally, somewhat dependent on the severity of the case. We use, if somebody has a profound anemia, then we use transfusions as an acute treatment. And, we start with prednisone and, stabilize the patient. If needed, we utilize transfusions again. In some cases, splenectomy may be a solution to this particular problem. And then more advanced cases, when patients are so-called refractory, then we utilize B-cell targeted therapies. Currently, this would be rituximab. I was super excited about this project. As being a rheumatologist and serving on different patient boards and participating in patient educational events, or even running clinical trials, I find that the patient's voice is hardly ever heard. So we have our own approach to patients, how we, as physicians and collaborators, because we also work with hematologists, how we communicate amongst each other, and we look at the patients empathetically, but mostly from the physician point of view. Is your hemoglobin count fine? Is your red cell count fine? Is your Coombs level this? And we treat accordingly. And we explain, let's say, the condition to the patient. We explain why a particular treatment is being utilized. But when it comes to how patients relate to their diseases or how they perceive their treatment and what are their emotional, psychological, physical experiences with the disease, we really have not enough time to address. We really don't dive into this as part of a visit. I also have to say we have very limited patient encounters during a follow-up visit and so forth. So when this idea came up in terms of approach the patients from the patient point of view, unsolicited, not necessarily we go and ask you, so what do you think about your disease? So what do you think about your treatment? So how do you feel about, are you hopeful or you're not hopeful? How do you relate to your own condition and your treatments and your sequential treatments following the diagnosis and discussion of how we're going to proceed? That never happens. So this just doesn't exist. So I think the approach of this unsolicited exam of how the patients relate to their conditions and the utilization of AI, I felt was a very interesting approach and a very candid way of looking into this particular aspect of the condition. And it gives us a bit of a better understanding of, one, how we communicate to the patients, or at least to me, how I communicate to the patients, how I handle the sensitivity to their needs, and also, opens up, obviously, a question and a conversation of unmet need, whether it's medication, whether it's emotional support, whether it's social support, whether it's, networking support, that obviously should follow this particular presentation. So the findings were that, when you look at different feelings, negative, positive, or neutral feelings, unfortunately, the patients relate to their conditions, unfortunately, progressively negatively. So even if we, utilize transfusions, we utilize rituximab, if the patient's condition is not well controlled and they go through these cycles of different drugs and different approaches, patients feel somewhat hopeless, unhappy, they have negative feelings, they feel that they have no control over their disease, they have no control over what's happening to them. And some patients feel that the side effects and the consequences of the treatments are such that impact their life. They feel that they cannot get back to their normal self because it's a chronic condition and not resolving and not well controlled. Well, I think a lot that should be done differently on our end is really education and communication with the patients and about their conditions, and understanding why they feel hopeless, and see if we can, maybe with better understanding of these treatments and better understanding of goals of the treatments, we can maybe modify their aspect of the outcome of these protocols, and also make sure that we communicate the chronicity of the disease a little bit better to the patients and open up a better conversation about how to manage those symptoms related to treatments, and how to get better control over their chronic disease. Now, obviously, the optimal would be if we find treatments that stabilize these patients a little bit better than what we have at this point. And, there have been a lot of efforts, different companies, different researchers, different, new medications and approaches that particularly address that. And hopefully that these newer mechanism of action drugs and provide a little bit better care for these patients, and they stabilize their disease. I just want to say that I'm, with the era of AI, we have a lot of negatives attached to this particular information technology method. That if I can say that, I think this was one of the projects where I felt that artificial intelligence had a particularly good place in that space and provided information that we wouldn't have been able to find or analyze in such a concise and such a consistent way. And I was very impressed by the findings and also the analysis.